We build hospitals to heal people, but to keep those doors open, these facilities act as massive resource sinks, inadvertently damaging the very environments they exist to protect. A modern hospital never powers down. Keeping it running 24/7 requires a constant influx of energy, water, and thousands of tons of single-use plastics. The byproduct of that continuous input is an equally massive output. Hospitals generate vast amounts of greenhouse gases and biohazardous medical waste, creating an ever-expanding operating expense just to get rid of it. Historically, the default method for dealing with infectious material in many parts of the world was simply burning it in open air. This practice directly releases heavy metals, like lead and cadmium, along with dioxins, furans, and high volumes of methane and carbon dioxide straight into the atmosphere. Treating waste disposal as a standard housekeeping line item ignores the reality. It creates severe regulatory and financial liabilities that actively contradict a healthcare provider's primary mission. RSUP Dr Sardjito in Yogyakarta, Indonesia, offers a proven alternative. It is a major public tertiary referral hospital managing highly complex operations. RSUP Dr Sardjito operates an 850-bed facility, managing a patient load of over 650,000 people annually from across the Indonesian archipelago. This chart shows their operational efficiency at scale. Despite the high patient load, the hospital actively recycles up to 15% of its daily medical waste and over 60% of its domestic waste. That material recovery translated to roughly $24,000 in direct cost savings in a single year. These outcomes are the result of a rigorous quality improvement (QI) strategy that embeds sustainability into the hospital's daily operations. To understand how they decoupled patient volume from waste generation, we can reverse engineer their operation stack. It relies on three foundational pillars: infrastructure upgrades, supply chain partnerships, and IoT data tracking. Operating a green hospital is a core strategic management function. It directly impacts the financial and operational health of the entire organization. The first tier of this transformation requires converting a high-liability process into a sustainable capital expenditure. Standard hospital incineration carries severe inherent flaws. Running these units requires high variable energy costs, and their toxic outputs introduce constant regulatory risk. In 2021, RSUP Dr Sardjito solved this by installing a specialized autoclave, funded in partnership with the World Health Organization and the UNDP. Instead of fire, an autoclave uses highly pressurized steam. This thoroughly disinfects infectious medical waste and renders it safe without releasing toxic pollutants. This schematic compares the two approaches. The incinerator on the left demands heavy fuel inputs and generates toxic emissions. The autoclave on the right uses a fraction of the power and zeroes out atmospheric risk. This completely eliminates the need for expensive air scrubbing technologies. Upgrading the physical infrastructure turns infectious waste treatment from a dangerous liability into a safe, highly controlled preparatory step for recycling. Processing technology alone cannot reduce total waste volume. To capture material value, you have to rethink internal supply chains and logistics. RSUP Dr Sardjito launched a 3R waste bank program to target high-volume, continuous waste streams, like used dialysis jerry cans and intravenous fluid containers. Before medical plastics are safely recycled, staff execute a strict protocol. First, systematic collection on the ward. Next, rigorous chemical disinfection. Finally, mechanical shredding on site. Once the material is safe and shredded, management makes a strategic choice. Rather than processing the raw plastic themselves, they outsource the final recycling stage to a third-party cooperative. This partnership effectively shifts the operational burden off the hospital's ledger, while strictly adhering to Ministry of Environment regulations to maintain full legal compliance. They apply a similar logistical approach to secondary streams. Organic domestic waste is diverted into composting, while treated liquid waste is drained into aquaculture ponds to feed farmed catfish and tilapia. Through this waste bank framework, a continuous, high-cost liability is converted into a tightly managed, quantifiable flow of assets. Moving hazardous materials through multiple parties requires strict accountability. That brings us to the third tier of the stack: Digital data integration. Historically, maintaining a secure chain of custody for biohazardous materials in a chaotic, high-volume healthcare setting has been incredibly difficult to enforce. To solve this, the hospital piloted the MeSmile application, an Internet of Things platform developed jointly by the Ministry of Health and the UNDP. On the hospital floor, the protocol is straightforward. Staff print and attach barcodes to specific bags of medical waste, then weigh them and input the exact data directly into the mobile app. As the physical waste is transported to a privately run temporary storage site for sorting, the digital data follows it. Upon arrival, the material is weighed again, and the data is re-verified. From there, the verified data pipes directly into the Ministry of Environment and Forestry's electronic reporting system, known as SIMPLE. IoT integration replaces manual logging with verifiable data, establishing a transparent, infection-minimizing chain of custody that meets strict regulatory standards. These tightly controlled systems operate within a highly volatile geographic reality. Yogyakarta is situated near active volcanoes and sits in an earthquake-prone zone, representing constant, severe external threats that demand highly resilient infrastructure. Because of this risk, RSUP Dr Sardjito integrates its environmental health protocols directly into its disaster management guidelines and emergency medical team training. Providing universal health coverage and baseline patient safety relies entirely on water, sanitation, and waste systems that remain unbroken during a crisis. A sustainable hospital is inherently a more resilient hospital. By securing its operational stack, the facility is capable of withstanding extreme environmental shocks without halting critical care. When we step back, the complete architecture of a sustainable hospital emerges, a synthesis of optimized physical infrastructure, mapped logistics, and real-time data tracking. All of these physical and logistical inputs ultimately combine, flowing directly into the hospital's central electronic medical record and hospital information system. The hospital's next phase involves incorporating artificial intelligence into this central dashboard, using this vast repository of data to further optimize human resources and clinical service performance. This operational model is highly scalable. The MeSmile tracking system alone is currently being replicated by 30 different hospitals across multiple provinces in Indonesia. Government ministries, universities, and professional associations are now utilizing RSUP Dr Sardjito as the definitive benchmark for modern healthcare operations. True sustainability is a highly coordinated systems architecture. It is not an isolated department, and it cannot be solved by a single technological fix. For hospital administrators, the primary challenge is always balancing upfront capital expenditures against the demands of an ever-growing patient volume. This model provides the necessary leverage. By optimizing the stack, administrators decouple patient growth from waste generation, secure strict regulatory compliance, and recapture thousands of dollars in annual savings. This directly counters the persistent industry myth that prioritizing environmental sustainability comes at the expense of operational efficiency or clinical care. Green hospital initiatives are an exercise in strict resource optimization and systematically eliminating leaks in the supply chain. Protecting the surrounding environment and delivering high-quality patient care are complementary outcomes of the same drive for operational efficiency.